Healthcare consumers are unlike typical consumers. Their experiences are varied and complex as they engage with multiple parties on emotional and personal topics. Healthcare is not a simple, one-time transaction with a single seller. And healthcare consumers face a multitude of options for services and often encounter a confusing payment system. And as we all know, the stakes are usually much higher in healthcare than in typical consumer transactions. Given these complex and evolving dynamics, having an in-depth understanding of consumer attitudes and behaviors has never been more important for health plans and providers. What are the moments that matter most as you navigate the healthcare system?
So, to me, it's the doctor. The best type of doctor for me is someone who doesn't rush me through an exam, who spends the time to listen to me and to answer my questions.
I didn't go to medical school, so I appreciate a doctor who explains to me what they're doing during the visit and what to do next.
I have diabetes, so I appreciate a doctor who gives me clear information about my condition and what to expect next.
To me, I want a doctor who helps me and my family create a treatment plan that fits with what's going on in our lives.
How important is getting affordable healthcare coverage that you can understand?
It's very important to me to know which of my doctors are in-network and what I'm going to spend. I am so tired of getting surprise bills in the mail.
I definitely don't like it when my coverage changes from one year to the next.
When I interact with my health plan, I want accurate cost information for my visits before I go to my doctor. Understanding cost is just really important for me.
I've had to wait for my health plan to authorize procedures in the past, so any health plan that can authorize in real time is a big plus.
Does convenience matter as much as provider experience or affordability?
Nah, I'd rather wait longer for an appointment if I knew it was going to be better than seeing the doctor right away, but then getting rushed through the exam.
Although I'd like to see a doctor right away, availability would take a backseat of having a meaningful appointment at a reasonable cost.
How important are digital tools to manage your health?
Not that important.
Not that important.
Relative to my interactions with doctors, not important.
Affordable coverage is number one for me. I'm not too concerned with digital tools.
I wouldn't say they're the most important thing to me, but I think they can help me interact with doctors better.
In order to better understand what mattered most to consumers, Deloitte used a non-traditional survey method that prompted consumers to prioritize which healthcare interactions are most important to them. We selected 64 interactions across the healthcare ecosystem and had consumers rank them using the bracket methodology, a tournament-style approach to prioritization.
From our recent research, we found that the most important set of interactions for healthcare consumers is the relationship with their doctors. If a consumer feels like the doctor really cares and spends quality time with them, then the relationship will last. This is especially true for seniors on Medicare. Affordability and cost are also very important to consumers. Understanding which doctors are in network, what services are covered, and what consumers have to pay out of pocket mattered significantly to them.
And the most surprising findings from our recent study were that digital engagement tools that are currently available to consumers weren't nearly as important to these consumers as their experiences and interactions with their doctors or affordability and cost.
So what can plans and providers do to help improve the customer experience?
Healthcare companies should refocus consumer engagement efforts to spend more time with the provider, medical management, and quality teams to ensure that these teams' priorities and investments align with consumer needs and preferences. Also, healthcare companies should collaborate with other players across the broader healthcare ecosystem in developing their consumer engagement strategies, because we all know that consumers have to navigate a complex and confusing ecosystem of healthcare players.
And by and large, healthcare companies' current investments in digital aren't working for consumers and aren't driving meaningful behavior change in these consumers. And so healthcare companies should reevaluate, not reduce, digital investment to help create integrated and effective digital experiences, and they should invest their digital assets to improve consumers' experiences with their doctors and promote better cost transparency and affordability.
We've heard directly from healthcare consumers and put a lot of thought into what they have to say about healthcare consumer engagement.
And by getting consumer engagement right, healthcare companies can turn members, patients, and consumers into fans, and fans into promoters.
And Deloitte can help you get there.
Okay, good stuff. You guys are great. Great answer. That's a wrap. Thanks, everybody.